Hey ladies, it's Dr. Takumbo or Yamoja, and I am back as promised with the video for the Maternal Wellness Postpartum HUD. I guess you can look at this as like a visual quick start or maybe even like a step-by-step / walkthrough of this HUD. So I did briefly describe and mention this HUD in the Lactacare Mom HUD and Baby System video, and so I do just kind of want to go over that really quick. I do want to also mention that this HUD is compatible with your Lactacare Mom HUD. So if you decide to purchase this HUD right before you deliver your baby, that's completely fine. You can start both of these HUDs on the same day. They are compatible. They use the same essentials such as the vitamins, the smoothies, and the teas. So you can absolutely wear these HUDs at the same exact time. These HUDs are designed for you to apply as soon as you have your baby, or maybe even the day after you have your baby, just because sometimes it could be like really busy on the day that you deliver. All right, so I'm going to show you how to purchase the HUD. We're also going to take a look at the essentials really quickly again, and then we're going to unpack it, go over everything. We have the activity watch, the pads, the herbal teas, and the pain medications, as well as the vitamins. Okay, so let's go ahead and get everything organized, unpacked, and I'm going to show you exactly how everything works. So here is the postpartum HUD. I'm going to go ahead and unpack it. I also do want to mention that when you do attach your unpacker, there's going to be a group joining link that you can join. That way, if you have any questions or you need any help or any type of support regarding any of the maternal wellness or Lactacare products by Maternity Medical, I can definitely assist you there. So again, read your note cards, ladies. I understand we are doing this video, but I always like to provide very informative note cards in your packages so that you could just take your time, read everything in depth, and then just kind of familiarize yourself like that. So let's go ahead and add this HUD. Once you see it pop up, it's going to attach on the right hand lower side of your eyes. You are going to be greeted with a prompt of how did you deliver your baby? So I delivered my baby vaginally. So I'm going to select vaginal birth, and how am I feeding my baby? I'm going to select breastfeeding. Immediately after you do that, you would have to add your doctor if you are going to a maternity clinic. If you decide to use this HUD and you do not have a doctor and you want this to be a more intimate experience for you, that is absolutely okay. You don't have to worry about adding a doctor. That is only for the medical role play side, for anyone who gets sick or become unstable during their 10-day postpartum experience. So again, if you do have a doctor, make sure that your doctor owns the Maternal Wellness Postpartum Doctor HUD, and then you as the patient need to add your doctor in the doctor button. So you're going to press doctor, you're going to add, and then you are going to type in your doctor's username. I'm just going to put my name in for the video, submit. And then once you submit in local chat, it is going to show you that you searched for that username and that doctor was added. You can add up to 2 doctors in your HUD just in case one of your doctors are unavailable. All right, we have a few more buttons in here as well, like the journal, display stats, hot stats. I'm just actually going to move this HUD over really quick and try to make it a little bit bigger so that we can see these numbers just a little bit more clear. Let's see right here, or should I move those to the other side? No, I'm gonna just, all right, this should be good. All right, so we have these stats hovering over your Maternal Wellness Postpartum HUD. Okay, it's gonna sit to the right of your screen. I'm just gonna make it big right here just for the video. So we have a few buttons. You can display the stats, which shows the hover text over your HUD, or you can hide the stats. If you don't want to see the numbers hovering over, you could just hit hide. We have a journal. If you want to make any type of notes or documentations throughout your postpartum experience for your doctor to review for your follow-up appointment, you can use your journal to do that. You're going to select add entry, and then you're going to write in your journal entry or a quick note or reminder or anything like that. So I'm just going to type in maternal wellness postpartum tutorial. How about that? Submit it, and then now in local chat it will notify you that you have entered a journal entry. And then now you can also view your journal entries. Click journal from your HUD. Once you click journal, you can click view last 15, and it will display the entry that or entries that you have input into your HUD. And again, once you visit your doctor during your follow-up, your doctor will also be able to pull those journal entries just to kind of see if you all need to discuss anything or incorporate anything within your role play. I'm just gonna display my stats real quick so I can see what's going on and show y'all what's up. We have a reset button. The reset button is only used for once your 10-day postpartum experience is up. This HUD is copyable, meaning you can use it for multiple pregnancies and multiple postpartum experiences. You will not be able to reset your HUD until at least day 11. Once you start your postpartum experience, it's going to continue on for a 10-day duration, and if you try to reset it before that, nothing is going to happen. Okay, now your doctor on the other hand can reset it for any reason that they need to reset it for, but you won't be able to reset it until day 11, and after you reset it, you can use your HUD again for the next pregnancy. All right, the next thing that we are going to go over is just the different stats, how we can keep up with our stats on the postpartum HUD, how to use the essentials, what everything means, and so on and so forth. You have the heart here, which is your overall health. You have your mood. You have your hydration, which is the little water droplet right here. You have your bleed flow. On the bleed flow, it starts out at 100%, but it will decrease naturally over the course of your 10-day postpartum duration. There's nothing that your doctor can do about this. There's nothing that you can do about this. It naturally decreases on its own. Just like real life, after you have a baby, you bleed. And so in Secondlife, we're only letting us bleed for 10 days on this postpartum HUD. Okay, so don't worry about that number. It will decrease on its own. Okay, ladies. Next up, we have the pads. You will see your pad stats. We also have activity. With activity, you have to start activity on day 5. It will not let you start activity before day 5. We want you to rest, okay? Day 5, you can start your activity with the Maternal Wellness Activity Watch. And then with the pain, the Band-Aid right there, every mom starts off with a pain level, whether you've had a vaginal delivery or a cesarean. Just like real life, once you push that baby up out your you know what, sometimes it could be a little painful. Sometimes some women tear. You do have to end up getting episiotomies, or even with C-sections, you have to get stapled or stitched back up. So in this Maternal Wellness Postpartum HUD, it does give you that pain level of your role play. That way you're not up just walking around like nothing happened the very next day or 2 days later. All right, so I'm going to show you how you're able to decrease your pain level. If you want to take any type of pain medication or role play taking pain medication with your doctor or at home, you can purchase the pain medications over the counter. But if not, the pain will decrease naturally over the duration of your 10 days during your postpartum journey. All right, so I'm going to go ahead and pull out some of these essentials, show you how everything works. As far as your stable stat, with that stays stable as long as you're taking care of yourself. It'll go into like high concern or need support or anything like that if you're not taking care of yourself. All right, and then if you do have a doctor, your doctor will be able to treat you or help you out if you do need some sort of support, if your essentials are not working because you've let your stats drop down too low. And then the last button at the bottom where you see the days, it just keeps up with the days of how far you're in on your postpartum journey, and then just the day of your bleed flow. So that will also change over the course of your 10-day postpartum journey. Okay, that's this little line right here at the very bottom. So that's also something that you can't control. It would just naturally flow and go during your journey. All right, so again, let me go ahead and show you all how I just feel like these numbers not showing all the way. But I hope y'all can see them well, because I want you to be able to see the numbers as they decrease or increase when I'm using the essentials. So over here, I've purchased everything for me to get started with my postpartum journey. So you're going to see all of the vitamins, the teas, the smoothies, the activity watch, as well as the pain medication. And then I'm going to res these things out on a prim here momentarily, so that I can show you how all of this works and what helps and support what stat. So right now we're going to start off with a smoothie. In your smoothie packages, there are 8 smoothies that comes in the packages when you buy them from the store, and each smoothie bottle has 10 sips in it. So we're going to go ahead and attach the smoothie. Once you attach it, you will see that it comes animated and you will show yourself sipping it. But in order to actually take the sip, you're just going to touch it. When you touch it, you will see an emote in chat and confirm that you have taken a sip. And then from there, you are going to see that it has increased your mood as well as your hydration. Okay, so smoothies and teas are going to support your mood as well as your hydration with your postpartum HUD. It is also going to increase your milk supply on your Lactacare Mom HUD. So just like I say, you can use these 2 HUDs together. They support one another, and even when you are recovering and taking care of yourself properly on your postpartum journey, it's also going to increase your milk supply within the Lactacare system as well. So if you can see, I'm taking sips and my hydration, my mood, and my milk supply is steadily increasing, right? So, oops. My bad, y'all. My bad. Let me get it right for a second. Alright, so again, as you can see, the more I take a sip, the more my mood and hydration as well as my milk supply is going to continue to increase. So the smoothies are very beneficial and very nutritious. It's the same exact thing for the teas as well. It's just more so of a preference on, do you want to drink tea or do you want to drink a smoothie? What vibe are you on? What mood are you feeling during this time of your postpartum journey? So I just took a sip of my lavender tea, and again, my mood, hydration, and milk supply has increased once again. All right, so let's go ahead and take that off. And so I also want to just revert back to the Lactacare Mom HUD video. So in that video, I did show you that you can take vitamins to help increase your milk supply on the Lactacare Mom HUD. So it's the same exact thing here with the postpartum HUD as well. The vitamins are very beneficial to you during your recovery. Although you may not be pregnant no more, vitamins are still very, very beneficial to mom, especially when it comes to your milk supply and feeding baby. So it's going to be the same steps. Res your vitamins out on the prim, and then after you have them resed out, because they are no copy, okay, you're going to touch it, and then once you touch it, you're going to receive that prompt on, do you want to attach it? Make sure you hit yes. That's the only way you're going to be able to start taking that vitamin. Again, nothing on this HUD is going to be absolute instant. So just give yourself some time and some patience, mom, to take it. You're going to see yourself actually animated taking your pill. You can take up to about 2 vitamins a day. They are, again, very healthy, helpful, and beneficial to you, but also use your doctor's orders if you have a doctor. Once the vitamin is complete, it's going to automatically detach from you. It's going to notify you in chat that your vitamin has been taken. And then you're also going to see that this is going to increase your overall health on your Maternal Wellness Postpartum HUD, okay? So my number started off at a 70, now it's at a 78. It's also going to increase your milk supply in your Lacticare HUD, so that's just a bonus. So yeah, that is how the vitamins will work. And then next we're gonna talk about the pain medication for your Maternal Wellness Postpartum HUD. So it's the same exact steps and routine as if you were taking the vitamins, except the pain medication, it is the Postadol 400 milligrams. Sometimes these can taste a little bit more on the chalky side, so these are recommended to be taken with a smoothie or a tea. So if you decide that you want to take some over-the-counter pain medication or request this medication from your doctor, make sure that you take this with a smoothie or a tea for you to be able to consume it. So you're going to touch the bottle, same as the vitamins. You are going to accept the attachment, click yes. You're going to see that the pain medication is going to attach to your fingers. And then once again, you will eventually see yourself actually taking this vitamin to consume. Once it starts taking, give it a few moments. You're going to be notified in local chat when it's time for you to take your sip of tea or take your sip of smoothie. It's also going to give you about 60 seconds to take it that way. If you forgot to attach the smoothie or tea, you still have a little time to go in your refrigerator and get it. So now it's time to take that sip. You're going to take that sip, and then you're going to see that your pain level is going to decrease, and it's going to tell you that your pain medication is kicking in, or it will kick in shortly. Now be mindful of the pain medication. It's very, very important to know that you should only take one pain medication per day. If you take more than one, now you are putting yourself at risk from taking your recovery status from stable to need support or concern or high concern, or maybe even needing medical attention from your doctor. Okay, and then if you don't have a doctor, you can always contact me here at Maternity Medical, and I can help assist you as well with that, because you won't be able to reset your HUD until at least day 11. So ladies, take your pain medication responsibly if you do not have a doctor tending to you during your postpartum care. Okay, so let's go ahead and, I'm trying to take off of my smoothie. There we go. Let's go ahead and take that off. I'm going to pick up my pain medication and my vitamins, and then the next thing that we're going to talk about is your hygiene / pad stack. All right, so just give me a moment to get this cleaned up, and I'll meet you in the bathroom so that I can show you how that works. All right, so right now we are at a 60 with our pad stack. Now what I will say is the pad comes with 10 pads in each pack. Sometimes when you're first starting off, you may have to change your pad a few times back to back just to kind of get that stack up a little higher. I don't recommend you letting your stack get lower than 40. Sometimes when it gets low, it can alter your recovery, just because it would think okay, you need to change your pad, or not really taking care of your hygiene. So yeah, if you get it up to about 100, once you get it up to 100, it'll give you a couple of hours before you have to change it. So how the pads work, you will just touch it. Again, you'll receive that attachment prompt. Select yes. Once you select yes, you'll see that the pad will attach to your hand, and you will become animated and begin changing your sanitary napkin. That's what I should have been saying, y'all, instead of pad. But yeah, so take your time. This is also a timed action. It's going to give you a little moment to actually get that cleaned up and get it changed. And then once it is all complete, you will see it prompt you in local chat, letting you know that it's done. And then voila, my pad stack has increased. Okay, so that's how that works. You can always send somebody to the store, buy you more, just to incorporate that in your role play. They are transferable, so they can transfer you the pads once they come back. And you know, you can just kind of do it like that, because you're probably going to run through a few pads within that 10-day time duration. Okay. And so, yeah, the only other thing that we really have to talk about now is how the activity watch affects your activity stat here. And then I've already mentioned earlier that it does take until at least day 5 for that activity to start. So here I am on the walking track in Suburban City, and this is a public track. So if y'all are looking for somewhere to just go walk around and get that light activity in, please feel free to drop down and use our Sportsplex. It's located inside the gym. But anyway, go ahead and let's add our activity watch. All right, once it's added, you're going to see yourself be animated and start your watch. And then you'll see it prompt you in local chat that your watch is ready for you to touch it to begin your walking session. All right, so sometimes I don't do the best with touching it or zooming in, so I'm going to right click and touch mine from my inventory. It also comes with a resizer, y'all, just in case, you know, you want yours to fit a little bit more perfectly. All right, so right here in local chat, it'll let you know, okay, your activity is about to start. And then from here, we're gonna go ahead and get this activity going for at least 8 to 10 minutes. Now, it is encouraged for you to lightly walk or whatever your doctor recommends. But for me, I'm going to do a little jogging. Of course, I've skipped my HUD to at least day 5 so I can do this for y'all. I was on day 1 when we first started this, but I had to up my HUD to day 5 so that we can actually get this going. So let's start this watch. Let's see. And then I'm gonna do some light jogging around the track. And again, moms, I'm a little bit more than 10 days post-op. My baby boy is about to be a month old while I'm doing this video. So I'm just gonna jog lightly because I got a wedding dress I need to fit in. But for you, it is encouraged for you to lightly walk or whatever your doctor ordered you to do. Just with the activity, you have to actually be moving, like moving around and making some distance for at least 8 to 10 minutes. So, woo, that was a workout for me, but I got it done. And as you can see in local chat, it has told me that I have completed my walk, and it says, good job, mama. So make sure that you do this. If you don't have a doctor, read your note card. It'll let you know what is a great goal to try to achieve. Let me stop walking. Okay, here we go. And then you will see that it will give you a score of 10. And each time you do that little walk, you will continuously increase by 10. And maybe towards the end of your days, you can maybe be up to about 80 on your activity stat. And so that'll kind of get you going around, moving around, shrinking that uterus and things like that, you know, girls. So yeah, I hope this video was helpful for y'all. I hope that y'all go out and purchase the postpartum HUD. I hope that y'all enjoy this immersive role play experience. I really enjoyed making this HUD, making this system, and making this video for you all. And until next time, I will catch y'all in the next video. So y'all have an amazing rest of y'all's day, and happy role play, mamas. Mwah.